Good morning, good afternoon, and good evening, everybody, and welcome to our webinar, which is going to focus on unbundling the delivery chain and provide practical examples of linkages between humanitarian cash transfers and social protection from across the globe. My name is Lois, and I work with the Grand Bargain Cash subgroup on linking humanitarian cash transfers and social protection. We're going to start the webinar today with our usual poll, just to give us an idea of who's participating, and then it'll give our panelists a good idea of how they can tailor their interventions. So you should see the poll in front of you now, and please can you select if you are a social protection actor, a humanitarian actor, both of these, or neither of these. We'll just run it for a few more seconds, and I'm going to count down from 5 to closure. So 5, 4, 3, 2, 1. So we should be able to see the results of our poll, where we've got 35% of attendees are in the humanitarian sector, 31% social protection actors, 22% cover both, and 12% are not involved in either. So just to give a little bit of background before we go into the substance of the webinar, the subgroup was formed 1 year after the World Humanitarian Summit in July 2016, and it's co-led by UNICEF, the IFRC, and DFID. The overall objectives of the subgroup are to try and understand the scope of efforts that are underway on strengthening links between social protection and humanitarian cash transfers, and to try and seek opportunities to engage and add value to current discussion and efforts. One of the third objectives of the group is to try and initiate a dialogue between humanitarian and development stakeholders on preparedness and response actions that are needed to support the links in times of crisis. And this need for better dialogue and better sharing of information and knowledge between humanitarian and development stakeholders has emerged as one of the key activities of the subgroup. So UNICEF is leading on the knowledge management actions, and that's funded by DFID. A key element of the knowledge and learning is part of this webinar series. So this webinar is one of the key actions, and there are a number of other ways that the subgroup is trying to share knowledge, including a weekly newsletter, a live and editable Google document, which is mapping links between humanitarian cash transfers and social protection approaches in response to COVID-19. And we are also going to be developing a series of case studies over the coming months, again, focusing on experience relating to COVID-19 and interventions where links have been made. Just to highlight, as you can see on the screen now, that we are also linked to socialprotection.org's COVID series of webinars. They've got a couple of webinars coming up next week. So the first one is going to focus on managing continuity and preparedness of school feeding programs under COVID-19 and the South-South cooperation role. That's on the 21st of July. On the 23rd of July, the second webinar will focus on social expenditure, legislative frameworks, and findings of impact evaluations of social protection in South Asia. So please do sign up for these, and you should be able to find the links in the chat box. I'm going to briefly introduce now our panelists and our facilitators. So firstly, facilitating the webinar is Karin Seyfert, who is Senior Consultant on Poverty and Social Protection with Oxford Policy Management. Thanks for waving, Karin. And then we have panelists from a range of different UN agencies and NGOs, and maybe when I say your name, you could just give a wave so everybody knows who you are. So firstly, Juan Gonzalo Jaramillo Mejia from WFP, he's the Social Protection Programme Policy Officer. From UN OCHA, we have Juliet Lang, who is the Humanitarian Affairs Officer for Cash Coordination. Oxfam Social Protection Advisor, Larissa Pelham. John Meyer, who is the Deputy Director for Food Security and Resilience for CARE USA, and Louisa Lippi from UNICEF, the Social Policy Specialist. So just to quickly describe the main objectives of the webinar before handing over to Karin. So the main objective is to present real-life practical examples of linkages between humanitarian cash assistance and social protection approaches at different stages of delivery, highlighting successes and challenges from around the globe. Karin will start with providing an overview of the framework, which has been developed by SPACE and which breaks down the delivery chain into three main components of policy, design, and operations. And the panelists will then speak to these different components and give examples from where links have been made. But we've also encouraged the panelists to say where the theory hasn't really translated into practice and where there have been difficulties around this. Some of the examples that are going to be presented are specific to COVID-19 interventions, but not all of them, because we've also been able to draw from really strong past experience, which we can then bring into COVID responses for today. The panelists aren't going to be going into great detail. We've been quite strict and said a minute, maybe 1.5 minutes each for what they want to speak about. So the pressure is on for them to be succinct. But the idea is that they can showcase some of these examples, and then we will be able to follow up with them if there are specific contexts that we're interested in or specific approaches that have been highlighted. And so I would really encourage you all to put any questions that you have into the chat box. We won't have time in the next hour to respond to them during the webinar, but the idea is that the panelists have committed to giving some time to respond to those questions after the webinar, and we will put them up on the socialprotection.org website under the Grand Bargain subgroup webpage. So I will now hand over to Karin to run through the framework and start facilitating the discussion. Thank you, Karin.
Thank you so much, Lois, and yeah, good morning, good afternoon, everyone. So this webinar, as Lois has outlined, is more about real-world examples about how routine and humanitarian cash assistance programs can work together. And the reason why it is important to link routine and humanitarian emergency cash assistance systems has been debated extensively in the past. So both within the Grand Bargain subgroup webinars and other socialprotection.org webinars. For instance, Rachel Slater, Paul Harvey, and Daniel Longhurst, they had a seminar in May, which you'll also find in the resources attached to this webinar. So we won't talk about why it's important. The value added of this webinar is different. We're focusing on showcasing practical, really short examples of how humanitarian cash assistance programs are working with routine national programs during an emergency response. And I just want to maybe have a short break just to talk, not break, but side note to talk about definitions. So by humanitarian cash assistance, we mean mostly emergency assistance delivered in a crisis, usually by international or non-government actors. And when I talk about national social assistance programs, I mean routine cash transfers, such as a conditional cash transfer for education, for instance, or a monthly cash transfer for vulnerable citizens. So this is just by term of definition. Now on to our framework. There are a variety of ways routine and humanitarian systems can work together in an emergency response. This will look different in different contexts, and at this stage we're not making a judgment about what is the best approach, but are focusing on describing the different approaches that we have observed. So first, emergency cash assistance and routine programs can be delivered through entirely independent and separate delivery chains. So that means separate governance mechanisms, separate registration processes, payments, etc. For example, and this has happened quite frequently in the COVID response, the government might focus on its routine cash transfer provision, while an international organization might provide quick, short-term, separate response to alleviate pressure on the government. So that's the first option. A second one is that the delivery systems may be aligned and coordinated, but remain institutionally independent. For example, a humanitarian program might replicate as much as possible existing features of a national program. It may, for instance, choose the same transfer, it may choose the same payment provider, or at least similar payment amounts, etc. Third, the humanitarian program and the routine national program may use parts of each other's system and borrow elements from another. For example, they may share the same beneficiary registry to coordinate their efforts and avoid overlap of serving the same people, or they may work with the same payment provider and provide transfers through exactly the same card, for example. And then fourth, an emergency response may be entirely run through national systems. And in this case, you're probably familiar with Claire O'Brien's work on shock responsive social protection, which describes various ways that national responses can respond to a crisis, for instance, by enrolling more beneficiaries, or what's happened through COVID-19, moving application processes online, or changing eligibility criteria, etc. So these 4 operational options are all equally valid depending on the context. So we don't intend to make a value judgment of what is better and what is worse. And importantly, and this is why this seminar is called Unbundling, not one option has to be used all along the delivery chain, but they can be combined. So for example, what this means specifically for the delivery chain, that it might be more helpful to systematically unbundle the social assistance delivery chain and examine different delivery options element by element. So on the slide, you'll see the delivery chain on the left-hand column, or if it's mirrored, you might see it on the right. And it consists of policy issues such as financing, legal and policy frameworks, governance and coordination, or design options such as how much to transfer, who to target, what kind of conditionalities to apply, or operations. So how do I set up my information systems? How do I manage outreach? What sort of protection mechanisms do I put in place? How do I set up monitoring and evaluation, etc.? And for each of these, you can choose any of the options we've just discussed in the previous slide. So you'll see in the top row, so you can choose to run it completely independent from each other. You can choose to align the system elements. You can choose to combine them, or to have them completely national system led. So for example, it might make sense to align certain aspects of the routine and humanitarian system while maintaining completely different structures for others. So a country might choose to fully take charge of, say, the governance of a humanitarian cash program. And this is then, the governance then is being government led. But the humanitarian and the routine program may decide to share beneficiary registry. And I hope you can see my mouse now, but for instance, so for registration and enrollment, you can choose to sort of combine the 2 systems and share. Or for instance, for outreach and communication, you may decide that actually for the humanitarian program, you want this to be completely independent. So the table that you see is a hypothetical country. It's just to illustrate that there's no need to choose any one approach for the entire delivery chain. So hence the idea of unbundling things. And choosing which approach to take goes beyond this presentation, but it's important to say that they are to be as practical as possible and to be guided by what is feasible. So strengths and capacities across these different elements should really influence the decision on how you want to work with them. And there are a lot of other trade-offs that we're not discussing right now because that's a completely different presentation. But the Space Help Desk, they've developed a decision-making matrix, which is also linked in the resources for this webinar. So have a look, because that will discuss how you should decide where to locate yourself. In what follows, we will go through the delivery chain and very, very briefly talk about examples and different strategies of linking national routine systems together. So we will start with policy. So this is questions about how funding is mobilized, who are the decision makers, and who should meet to take actions. And I'm handing over to Larissa to give us just a brief overview of sort of an approach that she has experienced. Larissa, over to you.
Great, thanks a lot, Karin. So in 1 minute, I'm just going to give you an example from our work in Vanuatu, where we have been delivering cash to disaster-affected households in what's the first example of cryptocurrency-enabled disaster assistance to remote regions. So we're trying to provide cash where there are barriers in capacity and in financial infrastructure. And as part of this program or project, we have established a multi-donor trust fund, which is situated within the Ministry of Internal Affairs, through which we distribute cash, through which we can distribute cash. And it's currently funded by the Australian government, the New Zealand government, and the Vanuatu Business Council. And really, this is the part of this that's really interesting for us right now, is that this is a platform that can include disbursement for humanitarian response, but also formal social protection systems and also informal social protection systems, so remittances. And it's really a model that's intended to scale up and transfer across all those 3 kind of aspects, so to transfer across the Pacific region. Have I done it within 1 minute? I think so.
Amazing, great. Thank you so much, Juan Gonzalo. What about your example?
Yeah, thank you. My example is mainly from Madagascar at the moment in the context of COVID-19, in where we've developed with UNICEF, UNDP, the World Bank, the European Union, and CARE financing platform where money has been pulled to support the government response to the socio-economic impacts of the pandemic. And it's been able to reach already 120,000 households and therefore over 1 million people. Similar approaches have been utilized by WFP in Dominica with Hurricane Maria in 2017, in the Philippines with Hurricane Haiyan, in Fiji with Hurricane Winston, and in Sri Lanka with the Ranu floods, and as well in that same year in 2016 in the Ecuador earthquake. So it's been a modality that has been used to support government responses to social protection systems. Over.
Great, thank you so much, Juan, Gonzalo, and Larissa. So these are two really interesting examples about financing. What about legal and policy frameworks? Juliet, can you speak to that?
Hi, well, I can't speak as much to the legal and policy, but what I can speak to is a little bit more on the governance and coordination consideration, which, as you mentioned, in terms of our own discussions at the moment, we're undertaking a couple of cash reviews, and these reviews attempt to unpack two key questions when it comes to that issue of governance or coordination. One is related to—
I'm sorry, can you come a bit closer? It's a bit hard to understand you sometimes. Thank you, that's perfect.
So we're seeking to unpack two key questions when it comes to these cash reviews. The first is understanding what could we do, and if we were able to do it, how could we do it? How could we bring social protection and humanitarian cash a little bit closer together? We know that these questions, in terms of what could we do or how, should we do it, are impacted by discussions around context. We know that natural disasters, I should say, very, very different implications when it comes to conflict or man-made disasters. And we also know that it's really critical to understand how we coordinate, and that is coordination both among humanitarian actors, but also across that nexus as such with longer-term national social protection systems. So we have two cash reviews underway, one in a natural context in Haiti, while the other one is looking at Somalia. And some of those reviews that we're seeking to understand are those questions of what is available at the moment, and if we were to try to reach everybody under the poverty line that has been impacted by COVID-19, could we do this? Should we do this? And more importantly, how would we do this in terms of leveraging coordination mechanisms? Thanks.
Thank you so much, Juliet. Really interesting. John, can you say something about sort of Ethiopia and your experience there on governance and coordination? I think you're still muted, John.
Sorry about that. Yeah, I recently spent 7+ years supporting the productive safety net in Ethiopia and have some observations about its coordination with humanitarian response. These are both huge programs and have over the years been essentially isolated from each other, separate management, etc. So we have and managed out of separate ministries. Now, from observation, this is more than a coordination challenge and has turned into, or had turned into, competition for resources, turf wars, kind of political infighting, and these sorts of battles. So the forces towards coordination, have met many obstacles. I think, in addition, the idea of unified management, each side is concerned that that would lead to bias, and the short-term humanitarians would outweigh the longer-term safety net folks, or vice versa. So that's the lay of the land as I saw it in Ethiopia.
Right, thank you so much, John. So those have been really interesting examples about how humanitarian and routine social protection systems link for financing, legal policy frameworks, and governance and coordination. There's another element which is capacity that's really cross-cutting through the entire delivery chain. So we decided to discuss this here in this element. So these are questions around how do systems, like how does system capacity look like from the outset? How can it be strengthened? And how can we also avoid overwhelming fragile systems? And while not necessarily talking about these specific questions, Louisa and Juan Gonzalo will talk a little bit about sort of what their experiences in working on capacity issues. Louisa, do you want to start?
Sure. Thank you so much. I wanted to talk about the experience that UNICEF has had on incorporating a focus on cash transfers and linking humanitarian response within our emergency preparedness planning and procedures. And we've invested quite heavily in Tajikistan and Armenia in both these areas. So we've started out doing a feasibility study looking at how the national systems can be leveraged to deliver humanitarian cash transfers. And these were done in 2017. Following which, we were able to invest again in building national capacities through different activities, such as trainings and workshops. We did a peer exchange visit. Both Tajikistan and Armenia went and visited Nepal to really get the government to understand, to buy into using the national systems. And I'll talk about this a bit later, but these have really paid off in this current context because we were able to really quickly scale up and adopt some measures, and the government was ready to do that. So I think investment in preparedness and incorporating humanitarian cash transfers or emergency cash transfers in emergency preparedness planning activities is essential. So over from me.
Really interesting. Thanks, Louisa. Over to you, Juan Gonzalo.
Thank you. We have the experience at WFP from Malawi, in where together with ILO and UNICEF and funding from the UK, we've developed, or we're developing with Valentina Barca, the shock responsive social protection module for the Transform initiative, which we're hoping also to make available through socialprotection.org very shortly for everybody. So that is aiming to enhance the capacities of government officials in Malawi particularly, but become a global good. The same for the Kenya School of Government in Kenya, where the training was developed for government officials with EPRI, the Economic Policy and Research Institute, but embedded into a university to ensure its sustainability, let alone the Southern Triangular Corporation bringing committees from El Salvador and Lebanon to Peru to learn about their cash transfer program and their preparedness to shocks. Over.
Cool, thanks Juan Gonzalo. Really interesting, also really interesting to embed this curriculum locally. I wasn't aware of that, really interesting. Moving on from sort of the high level policy issues to design issues of a program. So that includes things like vulnerability assessments, targeting, transfer value and frequency, and conditionality. So that would answer questions about who's eligible to benefit, how big a transfer is enough, how many times should a transfer be made, etc. And here again, there are various choices that can be made. So let's start with vulnerability assessments. Juan Gonzalo, again, over to you. Do you have a short example?
Yes, I have it from Tunisia. Because through the mobile vulnerability assessment and mapping NVAM platform of WFP, and upon the government request, WFP is conducting a multi-sectoral assessment in rural areas to inform the national social protection response to COVID-19. Similarly, in the region in Libya, we're conducting an assessment with the World Bank with the view of developing the system and the national strategy. Thank you.
Great. Thank you so much. Let's then move over to targeting. Juliet, do you have any information for Somalia and Haiti?
So as I mentioned, we're undertaking these two reviews in Somalia and Haiti, and in terms of the discussion around targeting, the key concerns regarding coordination are predominantly around the idea of gaps and overlap, and these two reviews are attempting to understand who is being reached with what and how are they being targeted. At the moment, as I said, these reviews are still underway, so while we don't have any results from them, what we can say is that there are some key considerations and kind of questions we do have to keep in mind. One of which is in relation particularly to protections and privileges. And we've seen this particularly in places like Somalia as well, in terms of data collection, ownership of registration, and how eventually that would or could interact with the government-led or potentially not government-led system, and how we would overcome some of those challenges indeed. The second one is also related predominantly to issues around humanitarian principles, which I believe is also going to be spoken about in the next issue regarding transfer values. In the context such as Haiti that we're also looking into, not only is there a concern regarding targeting, but also a key issue regarding what is a humanitarian principle when it comes to transfer. For example, how do we avoid sustainability questions or dependency questions with the government? In particular, what happens when a humanitarian transfer, we believe, is significantly larger than what a government social assistance or social protection amount would suggest? Thanks.
Yeah, really interesting, Julia, and really thorny issues around sort of ownership of data and transfer values. John, over to you on targeting.
Yeah, back to Ethiopia, for the safety net, the eligible targets are households deemed chronically food insecure, while to receive humanitarian support, you would be acutely malnourished or food insecure. And the rule is no overlaps. You receive one or the other. So it sounds sensible, but with the vast expanses and challenging terrain of Ethiopia, just imagine how difficult it is to identify households and classify them in this way. So it's been a huge challenge. The current effort is to bring together a single registry for all households and to classify them as either chronically food insecure or having acute need. And this will help enormously. Some worries about a large centralized database kind of locking people into categories and from which it would be hard to escape. And also, you know, husbands and wives don't share a last name, various spellings of different words. So even that is a bit problematic, but that's the effort that's underway.
Great, thanks, John. And yeah, Larissa, you had something on conditional top-ups, which is probably interesting.
So I'm just going to thank you. I'm just going to go across the border now from Ethiopia into Kenya and talk a bit about our response to COVID-19 there. And in Kenya, we have, so along with a number of partners, we have set up an urban cash transfer in the informal settlements of Nairobi, and we're targeting about 20,000 households in collaboration with the government. And how we're really collaborating with the government around the targeting aspect of it is that what we have done is we have identified where the gaps are in the current government provision of support, social protection support during COVID-19. And we have targeted either the people that have been the increase in the number of people that need to be reached but are not currently being reached, or by topping up the cash transfers that and it's actually unconditional cash, but the cash transfers right. that the government is providing to people. So we have identified those that are currently receiving government support and either topping up their current support from the government to ensure that they get 50% of the minimum expenditure basket. And then plus, in addition to that, using local administrative lists of very vulnerable households, we are targeting those that aren't receiving any government support at all. And then we're obviously going through a verification and registration and then onto delivery as well, and doing all of that remotely. Thank you.
Great, thank you so much. Like really great examples. And Larissa, it's perfect timing. Your question or your example almost answers one of the questions that we got from the audience about examples about sort of mixed transfers. So I think that's kind of a good example or one that could be used. Now let's move on from targeting to discussions of transfer value, frequency and modality. And yeah, let's see if maybe John or Juan Gonzalo's examples pick up on the issues raised by Juliet on aligning transfer values. John, do you want to start about Ethiopia?
Yes, I would. Thank you. You know, we're here speaking about cash, and I think I certainly am an advocate, as I'm sure we all are. Just a vote for food, though, coming from rural communities where the value of cash has, there's been reluctance to adjust based on inflation and cost of living. And particularly from the women we serve, you know, they're still voting for food, in-kind transfers, because of, you know, kind of the consistent value, and also it's much easier to control by women. So that's a comment observation from Ethiopia.
Great, thanks, John. And Juan Gonzalo, do you have an example, I think, from Colombia?
Yes, from my own country, we've seen that WFP has a scale-up assistance in support of both migrants, Venezuelan migrants, and host communities that are currently excluded from any social protection or emergency support in Arauca, the region that is bordering Venezuela. It is reaching approximately 40,000 people, and the value of the cash transfer has been aligned to the government's emergency program. We've seen similar to this in the issues of the transfer value in Madagascar, where we applied an essential needs approach to inform the value of the transfer, and the minimum expenditure basket in that sense was not only covering food, but water, electricity, and medicines. In the Dominican Republic and Pakistan, we've utilized the food fill the nutrient gap or cost of the diet to assess the value of their program. For example, in the Dominican Republic, Quédate en Casa means stay at home. So it's a CBT package that is going to do a vertical and horizontal expansion to the program, thanks to FNG. And finally, with Mozambique, we have a very good partnership with UNICEF. And there we have also changed the frequency to ensure that we do advanced payments equals to 3 months for approximately 110,000 households. So that's for me.
Great, thank you so much, Juan Gonzalo. And speaking a little bit about transfer modalities, and I noticed that John, who unfortunately had to leave, he already pointed out that in Ethiopia there is a debate between is cash or food the best modality. Juan Gonzalo, do you have an example from Fiji as well on modality?
Yes, this is a really good example, and I think it answers the question that has been already raised in the chat. In Fiji, WFP has a record of promoting cash instead of in kind in response to the Hurricane Winston back in 2016, and currently in the context of Tropical Cyclone Harold that hit the island back in April. So why was WFP promoting cash instead of in kind? For 3 reasons. First, because the markets were functioning, and for logisticals and financial efficiency concerns. Even if the country was pushing for in kind, well, we did with WFP, Save the Children, and Oxfam a cash feasibility assessment, and we're able to demonstrate through evidence that this was a better way to go. But the most important thing is that WFP is committing to enable governments' capacities and strengthen their national social protection system. So since they have a very good social protection system, a functional one, it was not the best idea to develop a parallel system, but rather put all the forces to enable the government to do a better job in their system.
Great, thank you so much. Thank you also for bringing in sort of the role of the government in the end. If we're speaking a little bit about conditionality, Juan Gonzalo, I think you also have some experience on how sort of you want to work with the government even when defining conditionalities for cash transfers.
Yeah, WFP adapts to government's request, and in Egypt we found that they already had a conditional cash transfer. So what we did before COVID is to align with the same conditionalities in the provision of a cash transfer in their national social safety net, or TACAHU, as it is said in Arabic, to lists of vulnerable nationals who were not covered by any scheme. So we saw that this was a very important collaboration with government that now in COVID has expanded coverage, and in terms of conditionalities, they have waived it, giving priority to pregnant and lactating women. They've reached 20,000 before, and now with this program in the COVID era, we're reaching 40,000 with government. Thank you.
Great. So this is a great example of sort of aligning conditions, but then also waiving them in an emergency and doing that in collaboration with the government. So really interesting examples here about design. I want to now move on to the next big chunk of the delivery system, which is operations. So operations involves things about information systems, how do you do outreach and communications, how do you set up monitoring and evaluation, So it involves asking questions like, how quickly can I register, enroll, and pay people? How do I organize applications, and in the context of COVID-19, crowd management? How to register and also resolve complaints and appeals. So this is what we'll talk about in the sort of third final chunk of the presentation. And for information systems, where we'll start, I'll hand over to Louisa.
Thanks. So I'm going to talk about an example coming from our work in Cambodia. The COVID-19 program there builds on the new cash transfer program for pregnant women and children 0 to 2, as well as the ID Poor database, which is a national social registry system aimed at identifying poor households, and the on-demand ID system, which was introduced earlier this year, which allows for more frequent applications into the National Social Registry. UNICEF supported the government to upgrade the program's MIS to include stronger linkages to the ID Poor database, and as well as the benefit calculation module. The link with the ID Poor database and the on-demand ID Poor database now allows for the data to be periodically updated in order for the newly registered households to become enrolled and come into the system more quickly. Something to bear in mind when you are using these national systems for an emergency response is that they tend to be developed to do routine and periodic enrollment and assessments. So they're not necessarily designed to handle such an explosion in registration like what we're seeing now with the COVID programs, and this can overload services and servers and cause crashes. So I think when we're thinking about using these systems, we need to come up with contingency plans and different IT workarounds in case such things happen. And so, and while these initial changes have been made to support the expansion of the COVID response, we also have a longer term view, and these will translate into some system strengthening in the future. For instance, the MIS can now be used to link with the disability allowance program. So it's a first step towards moving towards a more integrated system of management information systems and benefits. That's over for me.
Thank you so much, Louisa, and really, really interesting. And I want to build on your point about how there can be some really severe shortcomings of using routine systems if they're not made for an emergency response, by sort of talking a little bit about the national system that responds in Pakistan. So the SAS emergency program is an entirely government-run response to COVID-19, and it uses routine beneficiary database, the NSCR. And there is an awareness of its shortcomings. So the biggest shortcoming is it's over a decade old. And that speaks to your point, Louisa, about how if you use a database that's a bit old or that's not necessarily regularly updated in an emergency response, then you might reproduce exclusion that already exists in that sort of routine database. But I just wanted to flag that this routine database is used in the COVID-19 response in Pakistan, and to deal with existing shortcomings, this sort of the PMT-based selection of beneficiaries through the beneficiary database is sort of complemented by a community-based targeting system. So you can also use sort of routine databases, but then bolt on other elements to sort of support or to make up for shortcomings in the database. Now, moving on to outreach and communications, and there I just briefly want to flag a case which is not a COVID-19 case, but it's in Turkey, where DFID and the Turkish Red Crescent deliver a cash transfer for refugees. And I want to point out that even though this transfer builds on very many government systems, for instance, for registration, etc., the outreach and the communication is completely separate. So the outreach and communication for the humanitarian cash assistance program is completely separate from the routine program. And the reason there is probably most obviously political economy, that the Turkish government is quite keen that the transfer of refugees is obviously dissimilar and is obviously donor funded compared to the routine transfer. So this is just briefly what I wanted to say about outreach and communication. Now, moving on to registration and enrollment, sort of that's a big topic. And Juan Gonzalo, do you want to speak about your experience in Iraq?
Yes, thank you. So in Iraq, WFP designed a mobile application to facilitate remote registration and update of information, which from one side eliminates the traditional lengthy paper processes and protects citizens' data, and also allows those in hard to reach areas to register without having to physically visit the public distribution system offices, and ultimately pave the way to establish a digital social protection platform in Iraq. So that's from me.
Really interesting. Thank you, Juan Gonzalo. And I want to just sort of bang onto that and come back to Pakistan a little bit to talk about registrations. And again, there it's a national system-led example where sort of a registration system via SMS was set up for the COVID-19 response, again, in the framework of the SAS emergency program. So this SMS system is more for registration. There's still a quite sophisticated enrollment process that is going on in the background, and that uses the social registry. But I just wanted to flag that even sort of national systems can use quite innovative new ways to register new beneficiaries. I also want to mention another, again, in Pakistan, another example for registration, which I found quite innovative, even though it's not in an emergency context, and that's for the Naya housing program. And something that is done there is that banking agents, so private banking agents, are used to help beneficiaries complete online forms. So that's a cheap way to reach many people and overcome illiteracy and also so ICT literacy barriers, since the banking agents complete the form. And a major shortcoming for this is, of course, that it requires really close monitoring of banking agents to make sure that they don't take any illicit fees or that the information that enters is correct. But I just thought this is an interesting example about using a sort of non-government arm also for registration, i.e. banking agents. And something similar could be done elsewhere where mobile money is frequently used, to use mobile money agents to register beneficiaries rather than setting up registration centers from scratch. So that's just a little example about registration. Moving on to payments and delivery mechanisms. Louisa, do you have a sort of a nice example for that?
Sure, I have two examples from Armenia and Tajikistan, which are similar in a way. In both of those countries, the emergency support is going through the national system and is providing a top-up to existing beneficiaries. So in Armenia, the top-up is going to families with children with disabilities, and in Tajikistan, it's going to families with very young children under the age of 2. Both are being delivered through the national social protection programs. In Armenia, it's going through the family benefit system. And in that situation, the families of the list of beneficiaries is sent to the post bank, who delivers the funds. The money gets transferred into their account, and then the postal workers go out physically and deliver the payments along with their normal payments, which is how they go. The postal workers go out and deliver them. And they're being notified in advance through a letter, again, through the postal system, that they will be receiving the benefits. They're also going to receive an SMS, but we're going through the traditional kind of systems. And in addition to the extraordinary payment, in Armenia, they're going to be receiving some a packet of information on hand washing, hygiene, kind of risk reduction behaviors, and some other issues as well. So that's in the Armenia example. In Tajikistan, similar again, the beneficiary list is being processed by the ministry, and then it gets sent to the Amamant bank there, and it follows the normal TSA procedures in how the payments are processed and issued. The families are notified using a communication template that has been previously developed as part of our preparedness work to let them know why they're receiving the additional payment, when they can receive it, and where they can receive it and pick it up as well. So those are the two examples of how they're going through the national systems in those two countries.
Great, thank you so much, Louisa. That's really, really interesting. Also, sort of your description about the physical carrying of the postal workers mirrors nicely a comment that we had from the audience of where I was saying technology isn't always a good fix in an emergency. Like sometimes you just have to rely on your feet, basically, and community processes. So that speaks nicely to that. Juan Gonzalo, do you want to tell us another example about payments and delivery?
Yeah, I have two examples very quick. One from Myanmar, where WFP is providing a digital mobile-based cash transfer service for government social protection beneficiaries that normally receive their entitlements through local banks. And it was possible because WFP has an existing contract with a mobile financial service provider, which WFP uses for its regular humanitarian cash transfers. In addition, WFP and UNICEF, and this does a really good segue from what Louisa was saying, jointly will provide complementary activities such as digital registration for beneficiaries, social behavioral change and communication to support government's cash top-up to the pregnant and lactating women across the country in the face of COVID-19 economic relief plan. And the other one, which is from Jordan, it's where we have facilitated the remote opening of mobile wallets for 200,000 additional families to the social safety net program and cash assistance programs in the country. This was done because we were able to conduct virtual information sessions with beneficiaries to inform them about how to open and use mobile money wallets, and by providing guidance about how mobile money payment service providers we're helping them with where their role in these programs. So we're supporting the full automation of the digital payment process, thus eliminating manual intervention and related errors. So that's from WFP side.
Right, thank you very much, Juan Gonzalo. And yeah, really interesting, also linking back to what Louisa said. I just want to very, very briefly mention the example of Lebanon, and that won't take a long time. It's just that the National Poverty Targeting Program uses exactly the same payment mechanism as the humanitarian program run by WFP. So they use exactly the same card. They have different colors, the card for refugees compared to the card for the national system, but I just wanted to say, other than that, it's exactly the same system. So that's a nice example of sort of systems borrowing elements from each other. Now I want to move on to the next big chunk, which is about protection and grievances. And I'm aware that protection and grievance aren't the same, but we put them in the same box also just for space. But Larissa, over to you, if you want to speak about an example of protection and grievance mechanism.
Great, thank you. So I'm going to focus actually a bit more sort of on the accountability side of grievance mechanisms. And I think, obviously the COVID-19 pandemic has really highlighted the importance of existing social protection systems for all. So in talking about the linkages with humanitarian response and where you make those linkages, it's critical that those social protection systems are there in the first place. And in fact, COVID-19 has given the space to advocate more for those existing systems around kind of the life cycle approach, the social protection floor and so on. And this is relevant to my next example, which is taken from Sierra Leone. An example of something that was actually designed for a previous crisis, but is actually going to be implemented during the current crisis. And in about 2015, Oxfam in Sierra Leone developed a system designed to aid the recovery of the health and education services in response to Ebola. And the mechanisms were to address sort of the complaints that were coming from citizens about access to those services, to understand what those complaints were, and then monitor how those systems have been delivered, linking with through an index and linking to national standards. And it's designed to work very much with local leaders, so the chieftain system in Sierra Leone, and also with policymakers, with members of parliament, who we're trying to help understand and respond to the complaints and adapt the design of their current service delivery around health and education services. So right now we're adapting the design to the COVID-19 context and looking at how services are being delivered in COVID-19 and then beyond in other crises and other emergencies. To give you just two quick examples around this. So we are looking at, for example, with education services, how well are those education services being delivered in remote areas as the government is trying to do distance online and distance radio learning? Is that actually reaching people in remote areas? Do they have that access to the internet and so on, as one of the attendees mentioned about access to technology and so on? Is that there? And then around health services, How are health services in Sierra Leone during COVID-19, how are they adapting to new protocols around patient safety and so on? And the aim through this is to kind of marry up where citizens have grievances and issues with the services that they are or are not receiving, and help the government to respond to that, and then help with kind of referral pathways and so on with that. Thank you.
Thank you so much, Larissa. Really sort of great in-depth example and a lot of things to get into here. Juan Gonzalo, do you have a few more things to add specifically on protection and grievances?
Yes, thank you. And this goes in line with the comment from Cesaltina Abreu that was asking about human rights approaches in our questions. So yes, we have an example of protection and grievance mechanisms from Jordan, because WFP supported the National Aid Fund, the NAF, to adjust its complaints and handling mechanisms in the face of the COVID emergency response. This was done by facilitating the remote operation of the NAF call center, reviewing the script for the operators as a result of COVID, and setting up remote referrals with other national call centers to make sure that those were duly processed. So that is all from my side. I hope that answered that question as well.
Yeah, really interesting, Juan Gonzalo. Thank you so much. And sort of a good practical example of humanitarian principles and putting them into practice. Now, moving on to the last part of the example section is on M&E. Louisa, you have an example on M&E.
Yes, in Ghana, UNICEF is supporting the Ministry of Gender, Children and Social Protection to deliver and monitor an extraordinary COVID cash transfer payment through LEAP to about 322,000 beneficiary households. On the monitoring side, it's supporting two streams. First is testing an innovative post-payment monitoring system through UReport with local implementers and beneficiaries. And on the second, it's supporting independent civil society monitoring. For the monitoring with UReport, questions are sent through SMS to 3 groups: program households, community focal points, and district social welfare officers. And it has questions on the delivery mechanisms, how that's working, use of funds, if risk mitigation measures were followed at payment points. And there are some issues with that in terms of getting the program beneficiaries to answer, and we're thinking that's around maybe literacy or internet connections and things like that. So to complement that, going back to the point earlier about technology isn't the answer to everything, UNICEF is expanding its partnerships with one of its pre-existing NGO monitoring platforms to have their members visit 32 communities to collect more in-depth feedback, again among the same three groups and along the same questions. The primary objective of the monitoring is to inform program improvements and modifications, particularly the COVID response, but also the longer-term work on strengthening the shock responsiveness of the system, also to document the process and demonstrate the relevance of LEAP in COVID response and recovery. This is particularly relevant in the context of ongoing discussions and advocacy for temporary expansion of LEAP to mitigate the socioeconomic impacts and support recovery. And then lastly, to test different innovative and alternative monitoring frameworks and to identify what can be streamed into the current operations and MIS program. Over from me.
Great, thank you so much, Lisa. That was also a really nice, meaty example. And we have the last example for Juan Gonzalo. And Juan, I'm going to give you the choice. We only have 1 minute left, so you can either speak about the M&E example of Malawi, or Louisa has maybe talked about this enough, and you also said you maybe want to come back to policy. So for time reasons, you get one of the two. And yeah, over to you. And I think you're muted.
I have to choose between, yeah, so I have to choose between one or the other.
Or you talk really, really fast. You have like a minute.
I will talk about legal frameworks, because unfortunately people still think that WFP plays a delivery systems role, and increasingly we understand that these things need to go in tandem. So you can have a shock, but you need to make sure that the system is adaptable and it's enhanced as a result. So we saw that in the case of Malawi. as well, where we supported the government to develop the crisis interventions to address the effects of COVID, a master plan, which is a central framework bringing together the social protection and humanitarian sectors together to address the economic effects of COVID in the country. And rather than having a social protection response and an emergency cash response, WFP supported the government along with the UN to develop one master plans for harmonized crisis cash interventions. So this would have links to the humanitarian sector, to the food security cluster, to avoid duplication, duplicative cash assistance at different levels, and to social protection to the Malawi National Social Protection Support Technical Committee. This is important because WFP plays two roles. One, in technically support the governments in the development of their national social protection policies. We see that in Haiti and Somalia, where the development of the policy has resulted in multi-million-dollar grants from the World Bank, where WFP has implemented also with UNICEF, particularly in Somalia. And also WFP has played a role in technically supporting the reform and expansion of the national social protection policies and associated legal frameworks in Kenya, Ecuador, Peru, Madagascar, Dominican Republic, and go over.
Thank you, Juan Gonzalo. It's clearly a rich topic, and I'm really sorry to cut you off, but thank you so much to all the panelists. I'm handing back over to Lois, and I'm sorry we ran over a little bit. I wish I could synthesize a little bit all the interesting examples, but we don't have time. Hopefully in the Q&A or later we have time to sort of synthesize all these findings a bit more. But thank you so much, and over to you, Lois.
Thank you very much, Karin, for doing an excellent facilitating job, and to all the panelists. And just for those of you who have joined in, just to highlight that if you look where the chat box is, there's a tab saying handouts, and if you click on that, you can have access to lots of different resources provided by the panelists and their agencies. And we will follow up with the questions in written form on the socialprotection.org website. We also will hold next month's webinar on the 13th of August. It's going to focus on the role of local and national actors in linking humanitarian cash transfers and social protection responses during COVID-19. But thank you all for taking time to come and listen, and again to the panelists and the panelist agencies for contributing. And I wish you all a very good afternoon, evening, and day ahead. Take care, everybody.